So, starting with today's lecture, in today's lecture, we are going to discuss the topic that is topic number 35 from the Kate's philosophy, and that is related to the prognosis after observing the action of the remedy, and that we call it as a Kate's 12 observation. So, in this, Dr. Kent explained about the observation that is observed after prescribing the remedy, that is what will be the prognosis after prescribing the remedy, or what is the action of that remedy after we prescribe to the patient. There are different criteria for this, and he named it as a observation. There are different observations we will see after giving medicine to the patients, and in this Dr. Kane explained about the 12 observation that he see after giving the medicine to his patient, and he put for these as a Kane's observation, or also we call it as a prognosis after observing the action of the remedy. So this is the chapter number 35, that is prognosis after observing the action of the remedy, and that we also call it as a Kent's 12 observation. So, starting with the topic, that is actually what Dr. Kent explained about his 12 observation. So, in this starting with lecture, after a prescription has been made, the physician commences to make observations. That is, after we prescribe the medicine or after we giving the prescription, the physician commences to make the observations. The whole future of the patient may depend upon the conclusion that the physician arrives at from these observations. For his action depends very much upon his observation. That is, what the medicine is prescribed by the physician, it will give, or it will relate to the future of the patient, may depend upon the conclusion that the physician arrives at from this observation, and for his action depends very much upon his observations, and upon his action depends the good of the patient. If he is not conservant with the important import of what he sees, he will undertake to do wrong things. He will make wrong prescriptions, he will change his medicines and do things to the determinant of the patient. That is, if you don't understand the observation, what is going to affect the patients, or what are the different effects that is seen in a patient after prescribing the remedy, then the physician may go wrong, and it is the that affects the patients. There is absolutely but one way, and nothing can take the place intelligence. If you talk with a great many physicians concerning the observations you have made after giving the remedy, you will find that the majority of them have only whims or notions on this subject and see nothing after the prescription is made. These observations I am going to give you have grown out of much watchfulness, long waiting, and watching. That is, Dr. Kent put for this observation after making many experiments and after waiting a long, and that is waiting and watching of the action of the remedy. And if the homeopathic physician is not an accurate observer, his observations will be indefinite, and if his observations are indefinite, his prescribing is indefinite. That is, you know that is homeopathic physician must be a good observer or the accurate observer. That is, what is the action occur in a patient after prescribing the medicine, he should thoroughly understand that observations, or he note that observations very well. That is, if he not understand what are the changes that are going in the patient, his observations will be indefinite. There are many observations he will see in his patients, and if his observations are indefinite, his prescribing is indefinite. That is, if he having a number of observation in a same patient after prescribing the medicine, his prescribing is indefinite. There are many medicines come in his mind, or there are different ways of prescribing to the patients. So it is very important to and good observer or an accurate observer after giving the medicine. Then it is taken for granted after a prescription has been made and it is an accurate prescription that it has acted. That is, if we make the prescription and that prescription is accurate, that it has acted. That is, if it is acted, we will say that it has an accurate prescription. Now, if a medicine is acting, it commences immediately to affect change in a patient, and these changes are shown by signs and symptoms. That is, if medicine is acted on a patient, that will make some changes in a patient, and these changes are shown by signs and symptoms. The inner nature of the disease appears to the physician through the symptoms, and it is like watching the hands upon the clock. The inner nature of the disease appears to the physician through the symptoms, and it is like watching the hands upon the clock. This watching and waiting and observing has to be done by the physician in order that he may judge by the changes what to do and what not to do. It is true that the homeopath is not long in doubt in many instances what not to do. There is always an index that tells him what not to do. If he is a sharp and vigilant observer, he will see the index for every case. Of course, if prescription is not related to the case, if it is a prescription that effects no changes, it does not take long to see what to do. Much patients waiting for a foolish prescription is but loss of time, and that should be taken into account among the observations. These observations taken after a specific remedy has been given sufficiently related to the case and cause changes in the symptom are those of value. So in this para, Dr. Kent explained that the physician must understand about, that is, what are the different observations that he will see after prescribing the remedy, and in that case he has that courage or that intelligence that he has to wait and watch to see the action of that remedy. And if he wait and watching, at that time he will see what are the different observations or what are the different changes that that is seen in a patient, and for this reason it has to select a specific homeopathic remedy to the patient and prescribe to the patient. So in the next para, Dr. Kent explain about the changes are beginning, what are they, what do they mean, and to do they amount. That is, what are the changes that we see in the beginning and what are they like, how they look, how they like, and what do they mean, what is their meaning, and what do they amount, and what is their amount or what is their value. The physician must know when he listen to the reports of the patient what is going on. That is, the physician must know when he listen to the reports of the patient what is going on. The remedy is known to act by changing of the symptoms. That is, the remedy is known to act by changing of the symptoms, the disappearance of symptoms, the increase of symptoms, the amelioration of symptoms, the order of the symptoms are all changes from the remedy, and these changes are to be studied. So, after prescribing the remedy is known to act by changing the symptom or by changing the symptoms and the disappearance of the symptom. What are the changes that you will see after giving the remedy? So, in this, there will be the disappearance of symptoms, there will be the increase of symptoms, there will be amelioration of symptoms, the order of symptoms are all changes from the remedy, and these changes are to be studied by the physician, and this we call it as a different observations that Dr. Kent studied while he is experimenting, or he put forth the Kent's 12 observation. So among the commonest thing that remedies do is to aggravate or to ameliorate. So in that case, the commonest thing that the remedy to aggravate or ameliorate, the aggravation is of two kinds. We may have an aggravation which is an aggravation of the disease in which the patient is growing worse, or we may have an aggravation of the symptoms in which the patient is growing better. So in that case, when we see about the aggravation, that is what are the commonest thing that the remedies do is it will aggravate or it will ameliorate, it will increase the symptom or it will decrease the symptom. So in that case, the aggravation is of two kinds, aggravation is of two types, and in this we have disease aggravation and the homeopathic aggravation. So in this they explain about, that is the aggravation of two kinds. We may have an aggravation which is an aggravation of the disease, that is if it is an aggravation of the disease, in that case in which the patient is growing worse, that is patient becoming worse, his disease condition become worse, and we may have an aggravation of the symptoms in which the patient is growing better, that is if it is an aggravation of only existing symptom of a patient, in that patient feeling better, that we call it as a homeopathic aggravation. So an aggravation of these disease, aggravation of the disease means that the patient is growing weaker and the symptoms are growing stronger, but the homeopathic aggravation, which is the aggravation of the symptoms of the patient while the patient is growing better, and is something that the physician observe after a true homeopathic prescription. So in this they explain about what is meant by homeopathic aggravation and what is meant by disease aggravation. So in this, an aggravation of the disease, if it is a disease aggravation, you will see that the patient is growing weaker, that is patient becoming weak and the symptoms are growing stronger, but the and the symptoms are growing stronger. In disease aggravation you will see that the patient is becoming weak and the symptoms are growing stronger in disease aggravation. But what is in homeopathic aggravation, in which the aggravation of the symptoms of the patient while the patient is growing better. In that case, the symptoms are aggravating, but the patient is growing better. This is the difference between the homeopathic aggravation and the disease aggravation. He will explain in this para, and in this he tell that when you see that homeopathic aggravation, it is means that you select a true homeopathic medicine or a true homeopathic prescription. The true homeopathic aggravation, I say, when the symptoms are worse but the patient says I feel better. In homeopathic aggravation, the symptoms becoming worse but the patient say that I feel better. So this is related to the homeopathic aggravation and disease aggravation, that is explained by Dr. Kent. Now we must now go into the particulars concerning these states as to the time and place, as to how the aggravation occurs, as to how the amelioration occurs, as to duration, etc. The aggravations and the ameliorations, the direction of symptoms, and many other things have to come up and be observed, and the judgment has to be passed upon them. So the aggravation and the ameliorations, the directions of the symptoms, and many other things have to come up and be observed, and the judgment has to be passed upon them. Then the first of all, the patient should be the aim of the physician. His whole idea should be centered upon the patient to determine whether he is improving or declining. So when you are treating the patient, or if physician is treating the patient, his whole aim is on the physician, that is he should be the aim of the physician, that is patient should be the aim of the physician, and his whole idea should be centered upon the patient to determine whether he is improving or declining. We have to judge by the symptoms to know that this is taking place. So we have to judge by the symptoms to know that this is taking place. Very often the patient will say, I am growing weaker, and yet you may know that what he says is not true. So certainly can you rely upon the symptoms and their story, which is more faithful than the patient's opinion. Then many times the patients will say, Doctor, I am so much worse, and yet you examine into his symptom and you find that he is really doing very well. Just the moment that he finds out that you are encouraged, he feels better and rouses up and wants to eat. But by the symptoms also, you can tell when the patient is really weaker, and if the symptoms are in taking an inward rather than an outward course, you will know. Even if he is encouraged, that there is no encouragement for him. We have in the symptoms that which can rely upon. In the old school, we have nothing but the information of the patient. The symptoms themselves must be collaborated. The patient's opinion must be collaborated by the symptoms. The symptoms do collaborate what the patients say in many instances, but the symptoms are the physician's most satisfactory evidence. So while you are examining the patient, when you see the observations in a patient, sometimes patient will say that, Doctor, I am becoming worse and worse, but I feel worse. But when you examine that, the symptoms are going to cease. So in that case, what is the real action? That is, patient is not feeling well, but the symptoms are going to decrease. So in that case, you have to see what is the truth behind the disease condition. Is really the patient becomes worse, or to seek the attention of others, he tell that I am becoming worse. So in that case, you have to verify that, and you have to understand between these type of patients. So this is explaining in this para. Then in next para, Dr. Kate explain about another general remark need to be made, namely that we should know by the symptoms if changes occurring are sufficiently interior. If the changes that are occurring are exterior, the physician must be acquainted with the meaning of them, so that he will know by that whether the disease is being healed from the innermost, or whether the symptoms have merely changed according to their superficial nature. Incurable diseases will very often be palliated by mild medicines that act only superficially, act upon act upon the senses, and though the hidden and the deep seated trouble goes on progress and is sometimes made worse, yet the patient is made comfortable, so that by the symptoms we can know whether the changes that are occurring are the sufficient depth, so that the patient may recover. The direction that the symptoms are taking is sufficient to tell that, especially the chronic diseases. So in this para, he explained about, that is, what is the direction of the symptoms are taking insufficient to the tell that, especially in chronic diseases. Now in next para, Dr. Kent explained about the first observation. Up till now, it is regarding the introduction to the observation of the Dr. Kent, and in this the main points are, that is, if you are prescribing the medicine, you have to observe neatly what are the different changes that you will see in a patient, and in this it is the disappearance of the symptoms and the increase of the symptoms. These are the different observations that you will see in a patient. That is, it will be the disappearance of the symptoms, it will be the increase of the symptoms, it will be the amelioration of the symptoms, or it will be the change in the order of the symptoms, and all that. And along with this, Dr. Kent also explained the difference between the disease aggravation and the homeopathic aggravation. Now from next para, he explained about the different observation. So what he explained we will see. A patient walks into the clinic somewhat stoop shoulder with a hacking cough that he has had for a good many years. You judge by his looks that he has been sick a good while. His face is sickly, he is lean and anxious, he is careworn, he is suffering from poverty and poor clothing and scanty food. Now you examine all of his symptoms and they clearly indicate that he needs an antipsychotic for the symptoms. Antipsychotic for the symptoms are covered by an antipsychotic, and from the history of the case you know he has needed it a good while. Upon prolonged examination, the antipsychotic you have in mind is straightened. You now examine his chest and discover he has not expansion that he ought to have, and you detect the presence of tuberculosis. And by feeble pulse and many other collaborating symptoms, you ascertain that the patient has been steadily declining. You give the medicine, and he comes back in a few days with a quite sharp aggravation of the symptoms. He has an increased cough, he has a night sweat, and he is more feeble. Now, the homeopathic physician likes to hear that he likes to hear of an ex- exaggeration of the symptoms, but but this patient comes back in a week and the aggravation is still present and is somewhat on the increase. The patient is coughing worse and the expectoration is more troublesome than ever. His night sweat have been going on. He comes back at the end of the second week and he is still worse, and all the symptoms have been worse since he took that medicine. He has comparatively comfortable before he took that medicine, but at the end of the fourth week he is steadily growing worse. There has been no amelioration following this aggravation, and he is evidently declining. He now cannot come to the office for he is so weak. So, with the example of this, Dr. Kent explained about the first Kent's observation, that is prolonged aggravation with decline of the patient. This is the first first observation of Dr. Kent. And with this example, he explained that is patient comes to you and he is having these different symptoms, and you think that the patient need a deep antipsychotic medicine, and at that time you prescribe the deep antipsychotic medicine without any investigation or without that much deep study of that patient. So at that time, when you prescribe the deep antipsychotic medicine for the patient comes to you, and with a later prescribing, you will see that the patient is suffering from a tuberculosis and having a deep pathological changes that occurred in his lungs. So in that cases, when you prescribe a deep antipsychotic medicine for this patient, his symptoms becoming worse and worse. There is no any amelioration that you see in that patient. The patient becoming worse and worse, and up to fourth week you will wait and watch after giving the medicine. But after this, there has been no amelioration following this aggravation, and he will evidently decline and he cannot come to the office for he is so weak. And now the patient becoming so declined that he not able to come to the clinic or the hospital of the patient and hospital of the physician. So in that way the patient becomes declined. So what is the interpretation of this example? Dr. Kent explained the different examples, and along with this, he explained the different observation that he see in that patient. So, in next para, he explained about the what is the interpretation of this case. So, what is the interpretation of this case? This then will be the first observation, a prolonged aggravation, and the final decline of the patient. That is patient having a prolonged aggravation and final decline of the patient. So what what have we done? So it has been a mistake. The antipsychotic was too deep. It has established destruction. In this state, the vital reaction was impossible. He was an incurable case. The question immediately comes up, what are you do you to do? Are you not going to give the homeopathic remedy? In such cases, the patient steadily declines. If you are in doubt about such action of the remedies and making the patient worse, you will probably have an undertaker's certificate to sign before long. So in that case, this is the interpretation of this case, that is patient having the first observation, that is prolonged aggravation and the final decline of the patient. And in that case, what have we done? How it occurs? So in that case, it has been a mistake. The antipsychotic was too deep. It has established destruction. That is the medicine you prescribe at that time. It is a deep antipsychotic medicine and that will causes a destruction in a patient. And in this state, the reaction or vital reaction was impossible. So he was an incurable case. And now the patient goes in a state of incurable disease. So in that case, the question immediately comes up, what are you to do? So in that case, what to do? It is the question. And now, are you are not going to give a homeopathic remedy in such cases? So what to do in such cases? It is not give the homeopathic remedy in that cases. So the patient steadily declines. If you are in doubt about such action of the remedies and making the patient worse, you will probably have an undertaker certificate to sign before long. So, in incurable and the doubtful cases, give an higher than the 30 or the 200 potency and observe whether the aggravation is going to be too deep or too prolonged. So in that case, you have to make sure that that is in the cases which are incurable disease or which are the doubtful cases. In that case, you have not to prescribe the potency more than 30 or the 200 and observe whether the aggravation is to be too deep or too prolonged. So there are many signs in the chest in such cases to make a physician doubt whether he will give a deep remedy when organic disease is present. Of course, this does not apply when the things are only threatening, when you have fear of their coming, but when you are sure of their being present. In the instance given, the probability is that the remedy has been too late and it has attempted to arouse his economy, but turned to destruction his whole organism. Then begin in such cases with a moderately low potency, and 30 is low enough for anybody or anything. So in that cases where the case is incurable, where you are doubtful, in that case you have to prescribe the 30 or the 200 potency and not beyond this. And in that cases you have not to give the deep antipsychotic medicine in that cases. So it is the what to do in that case. So when the patient does not seem to be quite so bad as the one I have just described, you get him a little earlier in his history before the trouble has gone quite so far. And then if you administer this same very high potency in the same way, you will make a second observation. Though the observation is long and severe, yet you have a final reaction and emulsion. The aggravation lasts for many weeks, perhaps, and then his feeble economy seems to react and there is a slow but sure improvement. It shows that the disease not progressed quite so far. The changes have not become quite so marked. At the end of 3 months, he is prescribed for another dose of medicine, and you will see a repetition of the same thing, and you may know then that mean was the borderland, and have he gone further, cure would have been impossible. It is always well in doubtful cases to go to the lower potency, and in this way go cautiously prepared to antidote the medicine if it takes the wrong course. So this is the first observation of Dr. Kent, that is explained by him. So this is regarding the first observation. After this he will explain the second observation. Today we are going to take only one meeting. In some time the meeting will be end. I think in 5 minutes. So if meeting ended, we will end the lecture. Up till now, what we finished, we take that syllabus only, and remaining part we will take in next lecture. Is it okay? Today we are going to take only one meeting. Huh? If meeting ends, it is the end of a lecture. Okay. Now we will see the what Dr. Kent explained about the second observation. Then the second observation is the long aggravation and the final slow improvement. So in that case we will see that there is a long aggravation but the final and the slow improvement that you will see in a patient. And if at the end of a few weeks he is a little better and his symptoms are a little better than when he looks dose, there is some hope that finally the symptoms may have an outward manifestation whereby he will attain final recovery. But for many years you may go along with prolonged aggravation. You will find in such a patient there was the beginning of some very marked tissue changes in some organ. We may know by observing the action of the remedy what state the tissues are in, as well as know something about the prognosis of the patient. So this is the second observation, that is in this case you will see that there is a long aggravation but the final slow improvement that you will see in a patient. But why it occurs, or what is the indication of that? That is the indication of that there is a very marked tissue changes in some organs in the beginning, and due to these marked changes in the some organs that will leads to the long aggravation, but at final you will see that there is a slow improvement in the patient. So in that case the prognosis is better, and you will see that at the last of the treatment there is a slow improvement you will see in a patient with the long aggravation. So this is the second observation that Dr. Kent uh, observed in a patient after prescribing the remedy. So in that case, what is the indication? There are the changes in the tissue in the beginning, but that changes in the tissue that are the deep changes, that after a long aggravation the changes will change, and finally you will see the slow improvement in that patient. So it is the view of Dr. Kent regarding the second observation, that is the observation is long and but the final improvement you will see in a patient. Now the third observation is that the third observation after administering the homeopathic remedy is where the aggravation is quick, short, strong with rapid improvement of the patient. So in this third observation you will see that there is a aggravation is quick, it is short and strong with rapid improvement of the patient. So whenever you find an aggravation comes quickly, is short and has been more or less vigorous, then you will find improvement of the patient will be long. Improvement will be marked. The reaction of the economy is vigorous and there is no tendency to any structural change in the vital organs. So when you will see the third observation, so in that case the patient is going to improve. In that case no there is no any vital changes present in the organs, then or any structural change that may be present will be found on the surface in organs that are not vital. Abscesses will form, and often glands that can be done without will suppurate in regions that are not important to the life of the patient. And such organic changes are surface changes and are not like the changes that takes place in liver, in the kidneys, in the heart and in the brain. Make a difference in your mind between organic changes and that takes place in organs that are vital, that carry on the working of the patient. So in this way, this is the third observation of the Dr. Kent, that is the aggravation is quick, short and strong with rapid improvement of the patient. So thank you friends.